brain fog, and auditory processing disorder. Since 2020 pandemic, our world has been evolving. Those who have had COVID-19 may have experienced cough, shortness of breath, headache, fatigue, and fever. These symptoms are well known, but research about the aftermath of COVID-19 is still ongoing. According to Talia Fleming, MD, she researched and discovered that about 20 to 30% of COVID-19 survivors may experience brain fog. That makes everyday tasks difficult. Brain fog may also affect one's ability to remember and concentrate. According to Harvard Health Publishing, brain fog is not an official medical term, but a way that patients can describe how they feel when they're thinking clouds. Brain fog may also include difficulty hearing and understanding in challenging listening environments. Recently, Dr. Bob DeSogra, an audiologist, presented research that analyzed MRI imaging following COVID-19 and its long-standing effects on the brain's auditory processing. The changes present in specific auditory areas could likely affect auditory processing abilities as well, meaning that brain fog may be associated with auditory processing disorder. Auditory processing can be defined as what the brain does with what the ears hear. Significant difficulty with auditory processing is often described and diagnosed as Central Auditory Processing Disorder, or CAPD, and can affect functionality, binaural processing, which is 2 ears, and listening in complex acoustic environments. Adults with CAPD may hear a sound but not make sense of it. They may also have difficulty following verbal instructions, locating sounds, remembering, and staying focused. What should you do if you're experiencing brain fog? Symptoms such as difficulty hearing and understanding in the presence of background noise. You should come in and make an appointment if you're experiencing these symptoms. It is important for you to discuss long-standing effects of COVID-19 with your primary care physician. After your doctor, they may recommend you see an audiologist for auditory processing, as we are the only one that can diagnose it. An audiologist can further examine your hearing sensitivity and processing abilities. Scheduling a comprehensive hearing test is the best course of action, since the audiologist will need to first determine your hearing ability. Should results from this evaluation to be within normal limits, the audiologist will likely recommend a central auditory processing evaluation. After the evaluation, if the audiologist finds auditory processing difficulties or diagnoses a central auditory processing disorder, they may recommend specific intervention. Current intervention options include, but are not limited to, audiology training, amplification, environmental modifications, and assistive listening devices. Intervention and recommendation options will be discussed in detail with you and your audiologist to determine the most appropriate action plan. Additional testing from other specialties, such as neuropsychology, may be recommended. There is not one surefire way to treat central auditory processing disorder. Intervention and recommendations are individualized to meet your specific needs. Please contact the office if you have any questions.